All right, I'm Bill Pierce, and welcome to APCO's video series, Coming Back Stronger, where we're going to talk about what's next, what kind of changes do we need to make in our healthcare system based on this experience we've had with the novel coronavirus. And today we're going to focus on hospitals and health systems, and I'm joined by two health experts, Dr. Kavita Patel, who is a practicing physician, has extensive experience as an executive in health systems, worked in the Obama administration in the White House, and worked for the late Senator Kennedy, one of the truly great legislators in Congress and the history of Congress. And I'm also joined by Peter Urbanowitz. Peter is the former chief of staff for the current HHS Secretary Alex Azar. He was also associate general counsel at HHS and worked for Alex Azar when he was the general counsel. He's worked in and out of the hospital industry for a number of years and is now a leader of Alvarez and Marcel's healthcare practice. So truly, we've got two experts here to talk about what needs to come next. And I'll start with you, Kavita. The first question to you, but really it's to both of you. But just if you want to start off with, which is, so what have we learned from the situation right now? And what does that mean going forward in terms of what we need to think about changes of our health systems, hospitals, et cetera?
Thanks for having me. I'll try to be brief because I'm sure we could probably, between the three of us, talk about this for days, not minutes. But I'll say that we're just not really good at thinking about kind of innovative ways to go beyond our borders, meaning our four hospital walls when it comes to taking care of people. And COVID-19 has kind of pushed on those limits, but there are also bright spots. I sit on a couple of health system boards, and one of our health systems, SSM, headquartered in St. Louis, Missouri, before COVID had 300 virtual visits amongst our ambulatory and kind of physicians, ER physicians. And with COVID, that's gone to 5,300. So I think some of that is not going to not all of that is going to continue, but I don't think not all of that is going to go away.
The two things that Kavita said, which I think is something we haven't focused on because we've been focusing on the cost of healthcare for so long. There are two trends that perversely have affected our ability to respond to COVID-19. One is the number of acute care hospital beds out there. There are many fewer acute care beds today than there were even 10 years ago or 20 years ago, fewer ICU beds. We're also seeing, as Kavita pointed out, supply chain. In trying to wring out efficiencies in healthcare organizations, we have gone to just-in-time delivery of pretty much, not everything, but many things in hospital organizations.
I think these are spot on, the type of things we need to be thinking about right now as we look to the future and how do we make the system stronger. What kind of government changes is that going to require? And as Peter said, there are going to be costs to doing this. How do we start to think about paying for these things and what kind of policy changes are actually needed at the federal level?
One thing that a lot of us who are in healthcare every day are concerned about is that COVID causes a kind of a pause or the brakes on value-based care, whether or not we need more beds or less beds, but being flexible in that need and also thinking about an adaptive workforce. Really, those things are hard to do if you're on fixed kind of what I would call more traditional rigid budgets. So you really want to align financial incentives and how you can actually put a financial budget together that is reasonable to execute. And so, there's a lot of ifs there, but I do believe COVID-19 has kind of pressed all of us in healthcare to think that way.
A good thing and a bad thing in this country is we tend to have short memories here.
Yeah.
And once the crisis has passed, we move on to the next thing and we forget about the crisis and we move on with our lives. That's a good thing, but it's a bad thing because we lose important lessons like this. Hopefully it's only going to come every 100 years, but increasingly we're going to see things on the horizon that are going to test this. So we're going to have to make sure we don't have short memories on this one. But after this passes, we're going to have to agree as a federal policy and state policies that we are going to pay for emergencies. We're going to pay for capacities. We're going to pay for what I call the firehouse strategy. We pay for the firehouse in our neighborhood, And there may not be a fire this year. And if there's not a fire in this year, we should all be very happy.
About the telehealth, so it seems to me that if that's truly here to stay and be expanded, one, there's an opportunity for the private sector here in terms of developing more technologies to use with telehealth so that more can be done via telehealth. And then what from a policy standpoint, and this is, Peter or Kavita, but what from a policy standpoint needs to be changed in order to make that a permanent change as far as that's concerned?
The big thing that has held back telehealth for a long period of time is the federal government, Medicare, not paying for it. And there are good reasons it didn't pay. It was concerned about overbilling, abuse, whether the service would actually be provided. So there are a lot of restrictions written in the regulation and even in statute that made it difficult to expand telehealth. But a crisis, causes things to change. And that's where it needs to start, by the fact that we've been paying for it in this emergency period. CMS will see it work, and then it'll continue. Private payers, I think, were on this already. Certainly more, if they can pay less to have someone monitored at home rather than go into an office visit setting, I think they're looking for ways to stretch the premium dollar and provide good care.
Ironically, there's still a pretty big gap in how comfortable patients are with certain aspects of sharing information, albeit pictures or even video, as well as a technology gap. And then on top of that, Bill, I'll just give you a practical point. I have a number of patients that need scripts in person because they're either a controlled substance or you can only have a certain amount. And it's actually hard to do that virtually. You can't. So we're writing hard scripts or calling someone who's in a clinic and having them write the hard script. So there's a little bit of a logistical challenge. So I think there needs to be balance on both sides. I would say that there's a number of things we do in medicine that we just do not need in-person visits for. And it would be much more convenient for the patient, like my 78-year-old mother, who does not need to be driving around to doctors' offices. But I also think we need to be pretty candid about having a financial model that supports or incentivizes your friend, me, to think that way.
Peter, if you could just say one short sentence for health systems, hospitals that are out there about how to come back stronger, what would it be?
We need to figure out how to be resilient. We need to figure out how to work through a crisis like this and learn the lessons, and then take them and redesign our healthcare systems or bolster our healthcare systems.
Thanks. Kavita, if you were to just offer any of your, a thought on something short to the point about how do we come back stronger to the hospitals you work with, to the physician groups you work with, what would that be?
Think outside the box with partnerships. I think this is the perfect time to kind of create alliances with the hotel industry, with restaurants, with people who are kind of not normally on our radar as healthcare providers, because they're certainly going to be doing the same and may not have the luxury of contacts. So thinking outside the box with partnerships.
Well, Peter Banowitz, Kavita Patel, thank you very much. This was Coming Back Stronger from APCO Worldwide. We're going to do more of these with Peter and Kavita and others. So thank you guys very much for this, and we look forward to the next time.